Continuing with the sympathomimetics, the route of administration of drugs, adrenaline. The most favorable route of administration is IM route, intramuscular in case of emergency, or subcutaneous route. The IV route is also attempted, provided it should be at a slower rate, low dose at a slower rate in order to avoid complication. But the most favorable route for adrenaline is intramuscular route or subcutaneous route. Intramuscular route is the favorable route in condition like anaphylaxis. Noradrenaline, it can be given as slow IV infusion. Isoprenaline, sublingual IM IV infusion. Dopamine, mainly by IV infusion. Coming to adverse effects of adrenaline. So usual on IM or subcutaneous route, the expected side effects are restlessness, palpitation, increase in heart rate, anxiety, fine tremor, skeletal muscle tremor, pallor, etc. But on IV administration, if it is at a faster rate, there is high risk of cerebral hemorrhage, ventricular arrhythmia, angina, precipitation of angina pectoris or myocardial infarction, etc. And adrenaline IV administration and even any other route, it is special precaution is mentioned or it is contraindicated in patients with hypertension, hypothyroidism or angina patients or patients with history of MI or stroke. Uses of sympathomimetics. So sympathomimetics, there are different classes of drugs which are selectively activating various receptors. So accordingly, the uses of sympathomimetics will also vary. Starting with first use, that is shock. In case of cardiogenic or hypovolemic shock, dopamine is the drug of choice. Why dopamine is the drug of choice? Because dopamine can stimulate the heart. At the same time, it produces vasodilatation, which is the requirement for treating cardiogenic or hypovolemic shock, reducing the workload on the heart by producing vasodilatation while stimulate the heart to pump more forcefully more blood. But adrenaline is not a drug of choice for cardiogenic or hypovolemic shock. But adrenaline is the drug of choice for anaphylactic shock. It is mainly given by IM route. And the reason why it is the drug of choice, three main reasons. The anaphylaxis is usually associated with a sudden fall in blood pressure, severe bronchospasm, and the massive release of histamine. So adrenaline can prevent the sudden fall in blood pressure by producing vasoconstriction and stimulating the heart. It prevents bronchospasm by producing bronchodilation, activating beta-2 receptor in the bronchial smooth muscles. And it prevents the actions of histamine, acting as a physiological antagonist, as well as prevent the release of histamine from the mast cells. So this is the reason why adrenaline is the drug of choice for anaphylactic shock. And previously mentioned, dopamine is a drug of choice for cardiogenic or hypovolemic shock because it produces vasodilatation but stimulates the heart. Third use, hypotensive state. The dopamine or dobutamine can be tried. Hypertension, another important use, hypertension. Alpha-2 agonist, methyl-dopa and clonidine is the drug of choice. They decrease the sympathetic outflow from the brain, reduces the vasomotor tone, producing vasodilatation, and also decreases the heart rate and force of contraction, resulting in fall in blood pressure or decreases the elevated blood pressure. Dopamine or dobutamine also tried in case of congestive cardiac failure. Local vascular uses of adrenaline. It can be used to reduce hemorrhage and to improve visualization during surgery because it produces vasoconstriction when locally administered, sealing the damaged blood vessels. It can be used as a nasal spray to treat epistaxis, bleeding from the nose. And it is also used along with a local anesthetic like lignocaine. It is an important use of adrenaline. Adrenaline usually combined in the ratio 1:80,000 or 1:1 lakh or 1:2 lakh for infiltration or nerve block or spinal anesthesia. why adrenaline is combined with lignocaine? The reason is very simple. The local anesthetic is administered to a particular site of interest where the nerve in that area of injection is blocked, or the impulse generation and conduction of the nerve in the area of injection is being blocked. But there will be a blood vessel passing through the area of interest or area of administration of local anesthetic, which will take away the local anesthetic. You can see the blood vessel. It will take away the local anesthetic in the blood to the systemic circulation to various vital organs. So the outcome of this will be the local anesthetic is rapidly removed from the site of administration or site of interest where it is supposed to act, and it is taken to the vital organ. The fast removal of local anesthetic from the site of administration will result in less intense anesthesia and also less duration of anesthesia. While the removal of the drug to local anesthetic to the vital organs, especially to the heart, it can cause cardiac side effects, say cardiac arrhythmia or cardiac bradyarrhythmia. So to avoid that, what we use adrenaline along with the local anesthetic. So when adrenaline is given along with the local anesthetic, the blood vessel in the area of interest where the local anesthetic is supposed to act or block the nerve, the blood vessel is being constricted. You can see here the blood vessel is constricted. So the blood flow through the area of administration of local anesthetic is reduced. That means the local anesthetic is not removed from the site of administration at a faster rate, and they are also not delivered to the vital organs at a higher rate. As a result, the local anesthetic will remain in the area of injection and will act in the nerve of interest for a longer period of time, producing a long duration of action. And being localized, it will produce more intense anesthesia. And since it is not removed from the site of administration to the vital organs, the side effects can be also reduced. So what is the advantage of combining adrenaline with the local anesthetics? First one, it can prolong the local anesthetic effect. Second, it can enhance the intensity of anesthesia at the desired site. And it reduces the systemic toxicity by the local anesthetic. As a result, we are able to use more dose of local anesthetic. But it also has some disadvantages because of adrenaline. The injection becomes more painful. There are chance of local tissue edema and necrosis because of vasoconstriction, and delayed wound healing again due to vasoconstriction. Cardiovascular complication, especially in patients with a history of hypertension or angina or MI or stroke. In such patients, there is a risk of complication due to adrenaline, and it is contraindicated in ring block local anesthesia. It can cause necrosis of the distal ends. Continuing with the uses of sympathomimetic, next use is as nasal decongestant. Nafazoline, oxymetazoline or silometazoline, they can be instilled in the nostrils. It will cause vasoconstriction of the blood vessels, reducing the nasal mucosal thickness and relieve the congestion. It can be also tried in cardiac arrest along with CPR. It is highly useful, especially salbutamol, beta 2 selective agonist on bronchial smooth muscle, highly useful for bronchial asthma, chronic obstructive pulmonary disease COPD, and status asthmaticus. Allergic disorders, especially in anaphylaxis, adrenaline is a drug of choice. I repeat 3 points. Adrenaline prevents bronchospasm. It prevents the sudden fall in blood pressure and prevents the actions of histamine. 3 reasons why it is the drug of choice. It can be also used as a mydriatic if we don't want encycloplegia. Adrenaline or its congeners are highly useful as mydriatic. And sympathomimetic, it can be used for open angle glaucoma because it decreases the secretion of aqueous humor. DPV-Frine is a drug of choice. It is a prodrug of adrenaline which is well absorbed from the cornea, and it can decrease the secretion of aqueous humor and highly useful in open angle glaucoma. Coming to other uses, attention deficit hyperactivity disorder ADHD in children, amphetamine is being tried, found to be effective. Narcolepsy, that is excessive tendency to fall asleep, amphetamine is being a CNS stimulant, is found to be effective. Obesity, though amphetamine or sibutramine were tried, but now it is not recommended for the use. Nocturnal enuresis in children and also for urinary incontinence, amphetamine is second drug of choice. As uterine relaxant, isosuprine or ritotrine to postpone labor or to prevent threatened abortion. Insulin-induced hypoglycemia, adrenaline can be tried as an expedient measure along with the glucose. Thank you very much.